أهلا وسهلا معنا الأخصائي يوسف الدكتور يوسف والأخصائية لينكس الدكتورة لينكس، أخصائية العلاج الطبيعي والمساج دكتور يوسف أخصائي مساج، ومعكم الدكتور محمود أخصائي ودكتوراه في العلاج الطبيعي. حنحكي شوي عن موضوع للحجات وللناس اللي بيعانوا من الركب ومن القدمين، حنحكي بشكل تفصيلي، وبعدين حنعرج شوي على منطقة البطن كيف نحركها. والفيديو السابق نسينا نحكي لكم بالنسبة للخضار للوقاية من كورونا، بدكم تركزوا كمان على المميعات اللي بتخلي الدم يتحرك بشكل كويس. افضل انواع المميعات اللي ممكن تاخذوها هي البصل والثومة. يعني البصل والثومة بدكم تكثروا فيها في السلطات، فخليكم مع الاخصائيين وان شاء الله تستفيدوا. حيكون الحديث بالعربي وبالاسباني وبالانجليزي، يعني اي واحد بيفهم في هاي اللغات حيفهم علينا. نتمنى لكم اوقات سعيدة. تفضلوا.
Hi everyone, I'm Lenis. So I'm here today to teach you how to improve a little bit the pain on the leg and ankle, knee, and how to work a little bit in the tummy to release gas, to improve digestion. Okay, so vamos a empezar trabajando la pierna un poquito para mejorar la parte de la circulación de lo que es la rodilla y el tobillo. Okay everybody.
يلا هاي بتتعلموا لغات كمان على البيعة، يعني ماشي الحال. فبس انتم ما عليكم لا ضلكوا هاللايكات وهالشير، الله وكيلكم وهم بيشتغلوا. وما هم الدكاترة هذول بس يشوفوا هاللايكات زي المصاري هاي لهم، بيصيروا يعطوكم اكثر. فاعملوا لايكات وشير، الله وكيلكم وهم بيشتغلوا. تفضلوا.
Okay everybody.
Sí señora.
So sí señor.
Gracias.
De nada. Okay everybody, so for example in that case that we have swollen on the knee and swollen on the ankle, we are gonna open a little bit the lymphatic nodes to can decrease this swelling. So we can adjust here, take here a little bit under the knee of him, and we are gonna just push a little bit, very very soft, because this area is really sensitive. The under of the knee, a lot of vessels, capsule, so we are not gonna do damage tissue, so just very soft like that. So here
انا حمالي بتقلكم كيف بدنا نشتغل على الاجر، على الركبه وعلى الاجر. محل ما بتشتغل هلا منطقه شوي حساسه، بتعمل بريشر شوي خفيف لحتى تلين الانسجه الموجوده تحت الركبه.
As well, we can because we are gonna remove all the swelling in this area, so we can open a little bit here on the groin here as well, the lymphatic nodes. So we can do by myself, or I can explain. For example, the patient just place the hands here, and I'm gonna just a little bit here, to push to open a little bit here the lymphatic nodes. Estamos abriendo aquí los ganglios linfáticos también para poder remover todo el líquido que pueda estar acumulado. Okay.
هذه المنطقة على الجروين اريا منطقة كتير مهمة، لأنه كل الشرايين اللي بتنزل على الإجر بتمر من هون. في مثلث هون بيمر فيه العصب الرئيسي بينزل على مقدمة الإجر والشرايين، فبنعملها شوي هون هيك حتى نفتح الشرايين ويجري الدم على الإجر كلها.
So we are going to start, proximal to distal, because we are going to, remove first this area, because when I'm going to remove the distal area, I need to have here empty, to can move all the fluid that maybe is causing the swelling. Okay, so I'm going to start just a little bit soft here massage and pushing a little bit up. Never pressure here Okay, I'm not gonna pressure here and just go to the lateral side of the knee like that. So that's good. Very good.
arms بشكل بطيء حول الركبة حتى إذا في سوائل مجمعة تطلع مع الدورة الدموية.
It's a very different and many techniques. Some of them that's very, you know, just very soft, just like that. So depends, it is not too much swollen or too much pain. In my case, I like, apply a little bit more pressure to can remove much better all the fluids that is here. But just in case it's a lot of swollen, so we are gonna go more superficial and more soft because could be painful for the patient. So vamos a ir despacio. Me gusta hacer presión. Hay maniobras que son un poco más, superficiales. Pero esto depende, si ya hay mucha inflamación y mucho dolor, lo hacemos. En mi caso me gusta hacer un poquito más de presión para ir removiendo el fluido. So, like that. Like that, and we are gonna, and you are gonna see the difference after the massage, how the fluid reduce and the swelling is gonna decrease as well. You can push a little like that as well, like a pumping, pumping all this area. And again, proximal to distal, like that.
خليكم مركزين على الحركات كيف عمالة بتشتغل. شوي شوي عمالي بتزيد الضغط البريشر.
Very good. So we continue. So when we are here and the ankle, the idea is all this area be empty, can go up. So remember a little bit here, then here, then here, like that. Now I go proximal to distal and go up. And move all this fluid like that. This is just in case any muscle strain, here ankle as well, problem, knee. Some people just, have fluid retention, so it's good as well. Very good. Okay. So after
very relaxing. I'm falling asleep, Clinic. I'm not going to do that.
He's not gonna talk because he's gonna fall asleep. You see, it's good. The result is good. So okay. So for example, after we finish here, we need as well the help of the patient. So I'm gonna tell him that that move, for example, the ankle. So you are gonna move like that, or I'm gonna assist a little bit. Because when I move the ankle and when he moves the ankle, he's gonna, activate all this area of the gastrosoleus, and it's gonna pump the veins and the lymphatic system, so it's gonna be easy, the fluids go and go. It is very swelling, we are gonna use a little bit more high the leg, to can, be easy, the remove of the swelling. Like that.
بتحرك المفصل تبع القدم لفوق ولتحت حتى تلين العضلات اللي نازلة من الركبة على القدم.
Like that. So I'm gonna help, for example, with a little bit here movement, because if the patient have a stiffness on the ankle, or for example have a stiffness on the knee, it's gonna be for him difficult, initiate the movement. So I'm gonna help you first, movement a little bit, relaxing, like that. That's good. So primero le voy a ayudar a él un poco con el movimiento, porque si mi paciente se le dificulta empezarlo porque está muy stiff, yo le ayudo para que luego él prosiga. Okay.
I understand what you said.
Yes,
you said
good.
patello.
Okay, so now, for example, another here, very good to help to decrease swelling, decrease pain, to move everything, to, here is the towel under the knee, or I can put my hand, and I'm gonna tell my patient, try to squish my hand with unique. So you are gonna try to squish, he's gonna squish, okay, go ahead, try to squish my hand here. So, like that, okay, wake up and do it. Squish my hand, like that, very good. So in this case, activating here the quads, is isometric contraction, is really good, relax. When it's too painful, it's swollen, and we want to, initiate, or like restart the movement as well. So one more time, squish my hand. So estamos aquí trabajando una contracción isométrica donde no hay movimiento, solo es estático, es static, no movement, y nos va a ayudar, relax, a que se haga un decrease de la inflamación y del dolor. Entonces no estamos todavía iniciando movimiento, ya sé que hay mucha inflamación. Again, go ahead, squish my hand.
عم بصير عم تحط ايدها تحت الركبه من الخلف، وانا عمالي بكبس لتحت حتى تمدد وتتخلص العضلات، ونرخي بتشد وبرجع برخي. هذا بلين العضلات تبع الاجر.
For example, so he learned this movement. So now we are gonna, put another towel or roll to do a little bit this one high, So now here is the same isometry, but when he squish, he's gonna extension of the knee a little bit like that. So here we are gonna, include a little bit, just a little bit more movement. So it's gonna relax more, it's gonna help more with the fluid movement and to reduce swelling. So go ahead, squish the towel there, and a little bit here, extension of your knee, like that. Very good. I can assist here. So si se dan cuenta, coloqué una toalla más para que fuera más alto, y ahora estamos haciendo una contracción más fuerte porque ya se inició el movimiento, ya se de relax, ya se ha bajado la inflamación. So queremos algo más fuerte para que se mueva más la sangre y para que disminuya más esa inflamación. One more time there, go ahead. And it's really good as well because the quads is a huge and strong muscles in our body, but when you have any kind of lesion here, the quads is the more difficult muscle to, to restart and be strong again. So this kind of exercise is gonna help you with all the things that we wanna do with the neck. Just relax, very good. So he can do this exercise at home as well. He is gonna hold, when he here, is gonna hold 5, 10, 15 seconds under comfort of level of him, and relax another 10 seconds.
هذا ستريس تعملوه بالبيت. اللي عملته كله مشان الاجر كمان. اذا في ورم بالاجر او انحباس بالاوعيه الدمويه بتلينها، وهذا عم شوفكم بتعملوا الاكسرسايز الستريتش هذا بالبيت.
That's good. Okay, very good. So now we are gonna continue with the area of the rest of the leg and of the rest of the ankle. So I teach him, so you are gonna move your ankle doing circles like that. So just do it. That's good. Both, both directions like that. Like that, okay? You are gonna go up and down and up, down. So le estoy enseñando los movimientos. Yeah, continue.
ستريتش للكاحل. تعمل مع عقارب الساعة وضد عقارب الساعة، ولفوق ولتحت.
Now,
تحركوا شوي 5 ثواني 10 ثواني.
Now you are gonna move your toes like a squishing as well, like that. Again, relax and do it many times like that, very slow. So he's pumping, all the fluids going up, you know, and relaxing as well because of the pain. Here we can do as well some isometrics. So it's very easy. I can help him, or he can use, you know, against the wall or against the other feet as well. He's gonna help you. So there I'm gonna try to move your feet up. You just hold, don't allow me to move. That's good. So this is kind of isometry to decrease, no, just hold here, to decrease pain, to decrease swelling, to restart the muscle. Now here, don't allow me to move down. No, don't allow me to, very good. And relax, and as well here, don't allow me here to move. That's good. And relax, and now here, don't allow me. I always gonna hold, you know, between 6, 10, 15 seconds. If you see sometimes it's a little bit difficult to restart, you know, the movement. So if any kind of lesion is here, it's gonna be more difficult, and the person is like, okay, what I have to push or hold, what I have to do. It's totally normal because the muscle may be sleeping for longer because depends of the lesion. Okay.
stretch مع مقاومة الضغط، يعني هي بتكبس على ميلي. إذا راح هي على الشمال أنا ما بدي أخليها، بدي شد إجري على ميلة اليمين. إذا هي طالعة على تحت أنا بدي شد لفوق حتى نعطيها stretch.
We can work here a little bit with the massage, you know, try to open, you know, here, the gastros here under, moving, squishing. Remember, massage with a lot of pressure is when the swollen is a little bit much better, it's not too much. When it's a lot and it's warm and it's red and it's like a shiny, the skin, we have to be careful. Do first the isometrics, well, with cryotherapy and isometrics exercise, and then throughout the days we are going to start with the massage and with the pressure. That's good.
بعد stretches عم تعمل مساج بحركة إنه من تحت ضفاه وعلى بطة الإجر. صراحة بتريح كثير. It feels really good.
We can work with the fascia as well, like that. You know, especially in this area where is the tibia, is more like a tissue, and fascia more like muscles. So we can find a lot of scar tissue here and adhesions. So it's very important to remove all these, because this is why sometimes the patient walk and is gonna feel like a here pulling or like a needle pain, and is gonna say, I feel that something is pushing me inside, and squishing is very bad feeling. So it's because the adhesion is growing in and getting the muscles, you know. So when you walk, it's like a something pulling, and it's really painful. So it's really important to remove all this like that in all the directions. To work fascia, we have to warm the muscle. Okay. So after all these things, we can teach you as well the patient and tell, okay, when you are at home, you are gonna use against the wall, engage here the wall here, or use your feet to do the isometrics. And you can, you know, at home in this position, elevate a lot of your legs, you know. For example, go to the against to the wall, keep it here with elevation, maybe 5-10 minutes, relax. When he's doing this one, he can, you know, like a writing with the feet, you know, for example, letter A, letter B, letter, you know, like a drawing the letters, you know. And it's easy, it's fun, and it's gonna help you to remove swelling, to restart muscles, you know, to remove scar tissue. Very good. So all these things is important. And then through the days, when the patient, you know, depends of the lesion, feel much better, we are gonna progress or improve to work in different positions, sitting, walking, you know, and continue the therapy. Okay, very good. Move the fingers as well. Do mobilization here on the ankle. You know, because when I do mobilization and when I do traction here and traction the knee and traction here, it's like a, you know, like do the joint. So everything that is here, the fluids and gas is going out. So it's really good. The scar tissue is gonna broken. So the mobilizations are really important. That's
كل هذا تسترتشز منيح على المفاصل الإجر مثل ما شفتوا بلشنا من الركبة ونزلنا على الإجر شوية لتحت على نص الإجر وبعدين عملنا الكاحل والقدم كله بالمساج للسترتشز
and mobilization. One of the mobilization here on the knee, you know, I get here and I just move. I put my thumbs here, you know, on the plates of the tibia, and I just move in and move out. So it's really good to improve.
تطوي الركبة وضغط من فوق لتحت ومن تحت لفوق.
Improve range of motion, stretching soft tissue capsule, because around and inside of any joint is a lot of soft tissue that sometimes we have no idea how to stretch and move. So joint mobilization is gonna help with that. That's good. Remember, all these things is gonna, you know, do it depends on the swollen kind of lesion, pain that patient is feeling. We have to be careful with all these things. Okay. So now we are gonna proceed. You know, it's a lot of many techniques. We try to, you know, to teach you or explain the easy techniques that may ease your life at home as well. So we are gonna now to work a little bit on the tummy to improve, you know, blood circulation, to improve digestion, to remove gas. People who have chronic constipation is awesome, and to reduce weight as well. It's very good. Okay.
شوف كل شوي كده نشتغل على البطن كده كمان بيزيد الدورة الدموية وممكن يخفف الوزن كمان.
So después de que hemos
Can they see my hands on camera?
Yeah.
Okay.
Okay.
اوكي بالمعدة طبعا في عندنا المعدة the stomach we have the
colon.
الانتستين small و large intestine او القولون يعني المصارين هلا الحركة تبع الجسم هون بالمصارين بتكون في عضلات جوا والعضلات بتتحرك بتكون تعمل بهالشكل هذا مشان هيك فضائل الأكل بس تكون بدها تتحرك لتنزل بتكون بهالشكل هذا بتعملها هيك وبتاخدها. هلا إذا الحركة هيدي بتتغير إذا بتمشي بطيئة بصير في عنا إمساك لأنه هالفلويد كله عم يمتص منهم وعمالي بتصيروا هارد ما عمالي بمشي وإذا بتمشي بسرعة معناتها بصير في عنا إسهال. فالمساجات للمعدة بتنظم الحركة هيدي وبتخلي كل شيء يكون بالانس.
Okay. So, les decía que ya después de trabajar aquí con la pierna hay muchos ejercicios que el paciente puede hacer y de ahí procedemos a trabajarlo de pie, de rodillas, de todas las posiciones. Vamos ahora a trabajar algo bastante simple también en el estómago para ayudar a la digestión, al estreñimiento y a bajar de peso. So usually this is good if you can do it at home, if somebody's gonna do it, you know, without t-shirt, contact, skin to skin. Yeah.
If you can be a model, you can do
then, yeah, so I'm gonna show here and he's gonna show it that as well. So in my case, we usually work, you know, with the oil, without oil, and we are gonna start from here to moving here and here again, you know, remember all the wrist here. So I'm gonna open here my hands and I go here.
خلوا كلهم مركزين على الحركات.
like that. That's good. And moving here, you know. This is like a warming and initiate, you know, improving the circulation and the oxygen. That's good. Like that. Okay, one after that, we are gonna start working, moving everything, but starting in this way, like when we're with the lymphatic, you know, moving that we have to move first this side to can go up, around and move everything, because if I move from here to here, here is gonna be full, so I don't have to space to remove. And in this area, you know, is the colon and go to the anus and go to release everything. So this is why we initiate the movement here.
الحركة بعد الإمعاء يعني محل ببلش يجمع الأكل لبرا. فالحركات هذه بصير يمشي الفضلات من هون حتى تتزن.
Remember, if just in case the patient report a lot of pain and swelling, we are not gonna do. It's more like a contraindication in this case, because we need to know what happened. It can maybe block inside and it's gonna be worse. So it is very painful and so swollen. Check with the doctor, you know, but the rest we can do it here. After, for example, when person eats something, is very good because it's gonna help you to release. So as you see, I'm going a little bit slow, you know, like that, removing everything a little bit up and go, like that, moving, you know. This is the descendant colon here. Now I'm gonna work with the transverse here. So like that, I usually work, you know, to the other side because it's a little bit more easy, but because of the camera, but we can show, you know, like that, because I can go moving here, like that, and then I go. See, a little bit here again, transfer colon, transfer, and go to the descent colon. Breathing is very important, because if I not breathe, the patient doesn't breathe very deep, I can go in to move everything, you know. So sometimes when he just release the air, it's allow me to go, you see, deep and move like that. It's a little bit uncomfortable, of course, but the idea is not be painful, you know. Like that. That's good. Then we go to this area, to the descent colon, ascendant colon, and it's the same. So we are gonna start and then move here. See, little bit here, like that. Slow, slow. It's like I'm moving everything with my fingers. He release air, I can go more deep and like a vacuum here. That's good. Okay, so we remove all these one like that, and you are gonna be the results. Okay, everybody. That's good.
منعنش يا عمي بالأحمر. إن شاء الله نكون أعطيناكم فكرة كويسة لعلاج القدمين، الرجلين، تخفيف الكرش، علاج المغص. هذه الأمور كلهم من الأخصائيين، وتكونوا استفدتوا. بنشوفكم بلقاء جديد. شكرا لكم. شكرا دكتور يوسف.
هلا بكل طيبة خاطر انهم تستفيد العالم.
¿Cómo está Lennox? Sí.
Muy bien. He say I'm relaxed, I can talk. I just hear he say.
It's okay.
Okay.
شكرا جزيلا.
Bye bye.